or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Happy Thursday. Welcome to You and Your Doctor, sponsored by All County Healthcare. I am your host, Dawn Graubert. All County is a Medicare certified home health care agency operating in Dade, Broward, and Palm Beach County. For more information, you can contact them at 954-717-7027 or info@allcountyhealthcare.com. Currently, we're trying to get Dr. Sameea Husain, a neurologist from Baptist Healthcare System, to join us, but we are having a little bit of technical difficulty. So in the meantime, while we wait for Dr. Husain, who is a neurologist working with movement disorders, including Parkinson's disease, we're going to chit-chat a little bit over here with Freddie Santori, who has been the producer of All County You and Your Doctor for the past 8 years. And I think he's been able to watch the changes of medicine and how different technologies and different scopes of practice have been impacting All County and the patients around us. So thank you so much for joining us.
Thank you for having me.
So for the past 8 years, you have been working with All County.
Yes.
It started out with Lou and now Delroy, and they have a consistency of aids, of social care, of all the things that they're working with, of even their marketing team, which I think speaks volumes to the essence of All County, to have that much longevity in their staff and their commitment to care.
It's true, and it's funny because we've known some of the people that worked there for years. Maddie, her son, a lot of people have come forward and became friends. You've even used the services at one time. I think they were your mom or your dad.
I've used them multiple times, and I think probably one of the hardest things is the finances for a family when your loved one needs care. And whether you've got long-term care or you're working out of pocket and trying to really validate and justify, are these expenses worthwhile for your loved ones? And when it comes down to your loved one needing care at home, keeping them in place, aging gracefully in place, or having to put them in a facility, that's where All County is so important and imperative in what they do. And aging in place, as you and I have worked together, has really become a hot button, and it's really, really grown. And we've talked before what people used to do in the multi-generational homes.
Exactly. And Lou was a pioneer with me, because there was a time that You and Your Doctor was on the air for 2 hours, an hour each day. It was a Tuesday and Thursday, because it was so vital for them to talk about what they did with the community. I didn't understand it at the beginning. I thought it was just simply another show. But after 8 years, you're not on the air, you're not on South Florida Oldies, which was a different deal before VCMG Live took it, and it's changing again. It was different back in the day because people really wanted to have the information. What do I do? Who do I count on? Who can I trust? And they're just a name in the business. All County has done really, really well through the years, and it's an amazing aspect that they bring to the table.
Over the generations, I've seen so much change. When my grandparents used to have a long-term care policy, they couldn't age in place at home because they couldn't have the continuity of aids. My grandmother would get rid of aids all over the place. It was well before I knew you, well before All County. And keeping an aid in place or a home caregiver in place was really difficult with personalities. So they had to go to an assisted living facility. And then the next generation, onto my parents, were able to age in place with the help of All County and with the help of caregivers and physical therapists coming into the house and occupational therapists coming into the house to help with showering, with eating, even just walking around the home or around the neighborhood when your kids can't do it or when you have no one else that can really do it with you. To know that that continuity of care is there is so important. And is it worth the money? Absolutely. Policies are really important.
Hey, Andrew, do you see the doc? She says she can see. Is she on? I'm not getting any response.
So as you've seen different changes and a lot of aging in place. We've even had people come on and work with how you make adaptive changes to your home, whether it be handicap railings or a wheel-in shower, different ramps that go into the house for adaptive care. So the aides can do that.
Oh, I think we have the doctor. You want to bring her over?
All right, why don't we, let's take a commercial break now so that when we get talking to Dr. Husain, we can roll right through. So more to come with Dr. Sameea Husain, neurologist at Marcus Neuroscience Health Institute of Baptist Hospital. More to come.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor, sponsored by All County Healthcare. Sorry for the technical difficulties, but I'm excited that we have Dr. Husain Wilson, a board-certified neurologist and director of Movement Disorder Neurology at Marcus Neuroscience Institute, which is part of Baptist Health South Florida. She specializes in diagnosing and treating Parkinson's disease and other movement disorders using advanced therapies, including medication management, deep brain stimulation, and minimally invasive treatments. Dr. Husain also treats general neurologic conditions and headaches. She serves as an assistant professor at Florida Atlantic University, Charles E. Schmidt College of Medicine, and is fluent in English and Hindi. Her patient-centered approach focuses on each individual receiving comprehensive care, connecting them with the right specialist when needed. Her address is 800 Meadows Road, and you can reach Dr. Husain Wilson at 561-955-4600. All right, let's welcome Dr. Husain to join us. Hi, Dr. Husain. Thank you for joining us.
Appreciate you so much. I remember doing this show before, and it's been a wonderful experience each time.
So thank you again for joining us again. I see you're in your car maybe, or in the office. So we're gonna get right into this. Tell us about movement disorders. What are neurological movement disorders?
Movement disorders encompasses such a variety of different neurodegenerative diseases, diseases that don't always have cures. And I think that Parkinson's disease, and this being Parkinson's month here in April, it's so important to spread the message that, you know, in addition to other movement disorders like dystonias and essential tremors and other things, Parkinson's is, you know, the second most common neurodegenerative disorder in the United States. So it deserves its own month and our time now.
How does it present itself differently than some other movement disorders?
So Unlike other movement disorders, there are early symptoms, and early symptoms are ones that folks may not even capture. Those could be something as simple as losing your sense of smell. It could be your handwriting changing, meaning it gets smaller, and folks will describe it like chicken scratch. It could be sleep disturbances, which may present themselves as simply insomnia or acting out of the dreams, bowel movement problems, constipation and things, whereby before the patient had normal and regular bowel movement. So early symptoms are quite innocuous in presentation, but the motor features are sort of the meat of the disease, and those present later on.
And those motor changes, because I'm thinking if you've got handwriting changes, we could say, oh, mom's having some tremors or loss of smell. Maybe now, right, it's a symptom of long-term COVID. It feels like a lot of those symptoms, I wouldn't even think quickly to bring them to you or a neurologist.
Absolutely. And this is the crux of the issue, is capturing these patients as quickly as possible. And to your point, no patient in the world would come see someone like me with early symptoms like that. However, once the motor features of the disease, i.e. perhaps a tremor that maybe is noticed only in one hand, slowness of their movements, with activities of daily living or just mobility around the house, balance issues, stiffness of their limbs, these are the motor features that really should prompt one to either see their internal medicine physician, general neurologist, and in the best of cases, someone like myself.
Now, is there early treatment intervention? Is that beneficial to come in earlier when you see some of these with medications or therapies?
Absolutely. There is gobs and gobs of research that indicate that early treated patients not only do better on their exams and scores that are, clinically relevant to myself, but really from a quality of life standpoint. And, our research really studies quality of life. They're called QOL studies. And quality of life simply means to us, we want the patient's narrative to continue on and for this not to define them or for their identity to become Parkinson's disease, but rather they stay who they are, they continue to live their life, enjoy their family and children, travel if they want, and do everything they wanted to do.
We were talking earlier how medicine has changed, how aging in place has changed. Tell us about some of the treatments and therapies that help quality of life.
So there are multiple medications that are on the market and have been on the market for decades. Oral medications were sort of the mainstay and continue to be, quite frankly. Now, we are utilizing patches that are applied to the skin. We are using inhaled medications, which are terrific. Moving on from that, you certainly have surgical treatments, which you made a mention of deep brain stimulation. And we have many other treatments coming down the pike in research. So there is a plethora of treatment options available for these folks.
Deep brain stimulation, for people listening, sounds a little scary. And if we're looking at a surgical procedure, what does that look like?
Well, that is part of our fellowship training in movement disorders, is really determining appropriate candidacy for these patients, because that is really the most important step, is deciding that the patient has reached a ceiling of efficacy of their medications and that they would benefit from having these implants put into their brain. So, I think it really hinges on having a movement disorder neurologist you can trust, a functional neurosurgeon that works cohesively and intimately with your movement disorder neurologist, and having that comprehensive care, knowing that the outcome is going to be one that you're proud of and successful in.
Does genetics play a part in Parkinson's or any movement disorder?
Absolutely. Most certainly in Parkinson's, in our Ashkenazi Jewish friends, we do see genetic mutations that can have some predilection to having Parkinson's. In essential tremor, we do see that it is autosomal dominant, simply meaning that someone in the lineage before you gave them to you. Now, Ashkenazi Jewish folks, essential tremor patients, neither of these categories of movement disorder patients may know anyone that had any of these diseases. But to your point, yes, we've studied these and this is what we've identified.
Are there genetic testing, things that we can look at if we know someone in the family had it and maybe we're having some symptoms, or even like they do with Alzheimer's or dementia, there's cognitive testing you can look at, or BRCA positive. Are there tests now that we can look at?
So not in essential tremor, but in Parkinson's, yes, there can be swabs in the mouth done to look for the LRRK2 mutation, which is found in Ashkenazi Jewish patients or in Ashkenazi Jewish people of ancestry. However, it must be known you can be LRRK2 positive and not get Parkinson's. You can also not be LRRK2 positive and get Parkinson's. So it's really more, I would say, academic. And, you know, in some families, it's gravely important that they know if that gene lives in their lineage. So those folks that want to get tested, we certainly can offer that to them. But I will be honest, most folks, when I explain it this way, they want to just sort of move on with their care and focus on treatment.
Because I would think sometimes the devil you know is better than the devil you don't know. If I were to find out that I carried this gene, do I then walk through life thinking every tremor, do I have Parkinson's? Every change in my mindset, every olfactory smell off, is it Parkinson's? Or am I better off just waiting? This is just, I guess, the things, the pros and cons of having so much information available to the public now.
Absolutely. And you've hit the nail on the head, because that really is the crux of why family members and even patients that, you know, have it, they make that decision for themselves, but they say, I'm not going to want to find out. And, you know, it's also a journey to decide if you're going to share it with others. So it's a complex situation, and we sort of do our best to navigate with the patient's guidance on where they want to go.
And progression. It's totally a generic question. What type of progression and longevity of life from diagnosis?
So it is a progressive neurodegenerative disorder whereby there is progressive neuronal death of the nerves in the brain that produce dopamine. You know, normal aging is going to cause insignificant neuronal death in the brain and mild changes in whatever is going to happen as a person is aging. But as a Parkinson patient is aging, they are still going to gradually worsen with time. However, this can vary among different individuals. So we always take that into account when we are sort of pursuing treatment.
And as far as diagnosis, right, we've got all these crazy symptoms that present. What's your final diagnosis? Is there a test? Is it a movement disorder? Or is it putting all the symptoms together and sort of categorizing it?
It is a clinical diagnosis outright. So, you know, picking up early symptoms coupled with motor symptoms, getting to the right practitioner, myself, you know, we are able to take a thorough history, do a neurologic exam, do a Parkinson's exam, and make the diagnosis pretty early on. If there are any questions, of course, you know, it's 2026. We have ancillary testing. We can do MRIs, dopamine scans, skin biopsies. I mean, there's all kinds of reasons, but, you know, again, somebody who's well trained is going to use that ancillary testing properly if necessary, because again, it can potentially delay treatment, and that's something we don't want to do.
We want to get right in there and start treating. It's their conservative treatment that we start with perhaps first, or it depends on where a patient is at for symptoms?
It absolutely dependent on the patient. You know, as I said, my inability to capture patients with early symptoms sort of precludes me from catching them at early stages. Early stages are when symptoms are only on one side. I really can't count on one hand how many patients I've captured in that stage. So folks are usually on stage 2, whereby they have symptoms on both sides of their body. They still function very independently. They do not need much assistance, if any at all, with activities of daily living. Their balance is still pretty good. So stage 2 is usually where these folks are walking through the door.
It's really interesting that you say it presents on one side, because people may say, did I have a stroke? Did my loved one have a TIA? Is that why there might be weakness or a tremor? But again, a reason to go see a neurologist as well.
Absolutely. And, again, being in an environment or a community where there is and are resources like movement disorder neurology, it's a blessing to be able to treat as many patients as I do, given the prevalence where we are in Florida and where I live. But take that time to do your research and find the right provider. And it is and will be a commitment to maintain care with them. But that is something that is sort of investing in your future, and I strongly encourage patients to do.
And with Parkinson's having their own awareness month this month, what are some of the cutting edge technologies and research that you see have changed since you've started?
So there are novel medications coming down the pike all the time. I've been involved in research for many years. In terms of those medications, they have to go through obviously all the phases, phase 1, phase 2, phase 3. So it does take time for them to reach the commercial arm, meaning the public. But there are gene therapies that are looking promising. There are disease modifying therapies that really are the holy grail, because they're trying to slow or halt the progression of the disease, which is really what, all patients are praying for. And then, of course, as you mentioned, research funding is so important in this disease, because wonderful organizations like, let's say, Michael J. Fox Foundation, these are hundreds of millions of dollars going into research, and volunteerism into these research trials is equally important, because, if patients didn't volunteer, these medicines wouldn't come down the pike. So, we really pick and choose the right patients to put into these trials or to recommend these complementary therapies for. But, again, boots on the ground are the traditional medications that have been used for decades. I strongly believe that, and my patients show for it.
Can we talk about early onset Parkinson's? You brought up the Michael J. Fox Foundation. He did not present typically as an elderly person and changes in gait and all of these symptoms. A young man. What is that? Does that present differently at different ages?
No, it doesn't present any differently. It simply is as a function of getting it early. I diagnose young onset, as it's called, in their 30s, in their 40s, all the time. But naturally, this is a disease of older adults. Age is a primary risk factor, and it's usually of men over 65. Men have it 1.5 to 2 times more than women in the United States.
And I would think that has to do something with, genetics or hormone balances. Why men over women to that degree?
They haven't studied that to any great length, but, there are discrepancies in the healthcare system, when it comes to the treatment of women in general, and when it comes to the enrollment of women in research clinical trials. So that could be playing a role. But again, I think genetics, to your point, is probably the most reasonable answer to your question.
Really interesting. And what's your takeaway? What do you want people to know for Parkinson's Awareness Month? Besides how to get a hold of you, what are some other key things you want them to take away from this?
I think that the hopefulness that should reside within once you've been given that diagnosis, because of course, the journey is initially going to include a path to acceptance, and everybody's path to that acceptance differs. I'm always there every step of the way. Majority of folks sort of accept it early on, and some folks take a little longer. But once they get to that point of acceptance, and they understand and have a well-trained movement disorder neurologist, that's where they understand how many medication options there really are, how many surgical, options we could present now and in the future, how much research is available. So I think it gives them hope, and I think that's really the take home from what I want to make sure that everybody remembers to do is stay hopeful, stay grounded, stay grateful, and just do your best every day. To your point, to exercise, take your medication, do your physical therapy, and just maintain a great relationship with your doctor.
Absolutely consult with your doctor, because you want to make sure whatever new medications or therapies you're using do not have a contraindication with some of the other medications from another physician. So coordination of care is critical.
Absolutely. And my patients know that they can reach out to me nonstop. I prefer it. And it's always a breath of fresh air for them, because they know they can, let me know they're on a new medicine. And believe you me, they do. And I love writing them back. This is okay to take. This is not okay to take, because what we've built is trust. And I think that's the most important part of Parkinson's, because neurodegenerative disorders, we don't have a cure right now. And so that trust is the most important thing.
Thank you so much, Dr. Husain, for joining us. My apologies for the technical difficulty, but I am so glad we were able to get you online and to talk about it. Building trust with your physician, and there is always hope as you move forward with the diagnosis. You can reach Dr. Husain at 561-955-4600, and you can reach All County Healthcare at 954-717-7027 for all your home healthcare needs. Have a great night, everyone. I am Dawn Graubert for All County, you and your doctor, and we will see you next week.